Welcome to rePROs Fight Back, a podcast on all things repro. I'm your host, Jenny Wetter, and each episode I will be taking you to the front lines of the escalating fight over our sexual and reproductive health and rights at home and abroad. Each episode I will be speaking with leaders who are fighting to protect our reproductive health and rights, to ensure that no one's reproductive health depends on where they live. It's time for rePROs to fight back. Hi, everybody, and welcome to a special bonus episode of rePROs Fight Back. I'm your host, Jenny Wetter, and today we're going to continue our ongoing series of special episodes I recorded while I was at Women Deliver, a global maternal and reproductive health conference. While I was there, I was lucky enough to talk to advocates from around the world about issues they are working on every day. In today's episode, you're going to hear a wonderful conversation I had with Vanessa Rios with the International Women's Health Coalition and Jade Maina with TICAH in Kenya. I talked to Vanessa and Jade about the global gag rule and a report that the International Women's Health Coalition released recently about what we are seeing 2 years in with the global gag rule, what kind of impacts we are seeing on the ground, and how it's being implemented. It's a really important conversation to make sure that we are grounding our talk about this terrible policy and then the impacts that people are seeing on the ground and what we will be seeing for years to come. So I hope you enjoyed this conversation. So since I have two people here, I'm going to let them introduce themselves so everybody can hear who's talking when. So first of all, thank you both for being here. So I'm going to throw to Vanessa first.
Hi, this is Vanessa. I'm a program officer for learning, monitoring, and evaluation with the International Women's Health Coalition.
And I'm Jade Maina from TICAH, that's based in Nairobi, Kenya.
Okay, so today we're going to talk about IWHC's new report, Crisis in Care, which talks about 2 years in, what we're seeing are the effects of the global gag rule. So, but before we can get there, I think maybe we should just do a little basic scene setting, which is, what is the global gag rule?
So the global gag rule, also known as the Mexico City policy, is a U.S. foreign policy that prohibits non-U.S. non-governmental organizations from using their own private non-U.S. funds to provide comprehensive abortion care. In most instances, these organizations are prohibited from providing counseling for patients on their available options. They can't refer them to other abortion services, and they also cannot organize or lobby to liberalize abortion laws in their countries or conduct public campaigns to educate people on abortion, and all of that as a condition of global health assistance. It's important to note that there are several things that are excluded from the policy. So abortion due to rape, incest, or where the life of the pregnant person is at risk, those instances are excluded from the policy. It also does not include post-abortion care services, and those are explicitly exempt from the policy.
Okay, and I think also just worth noting, one, if you want a fuller explanation on the global gag rule, we have an episode that we released earlier that you can go back and listen to. I'll make sure to tag it in our show notes so people can listen to that as well. But also just worth noting that it has been a political football that goes back and forth and has been around since under Reagan. But right now it is under a vast expansion from what it used to be in previous iterations.
Yes, previously it only applied to family planning funding and a much smaller number of organizations, and now it applies to all global health assistance, so that encompasses not only family planning, but HIV services, which is the biggest pot of global health assistance funding, malaria, TB, maternal child health. All of those streams of funding are being affected by this policy, and that's almost $9 billion US dollars annually.
And to give you a sense of scale, it went from affecting about $600 million to $9 billion. So that's just huge. Okay, so last year IWHC did a report looking at what we were seeing under the first year of the global gag rule. Do you want to talk a little bit about what that report said?
In the first year of our report, the policy was just starting to roll out. The way the policy is implemented is through a contract provision, and what that means is that it didn't all just apply to all of the organizations at once. It was really contract by contract as organizations were signing new contracts or receiving new disbursements of funds. So there was there's a lot of confusion around the policy. A lot of organizations were being affected for the first time since this was much more expansive than previous versions of the policy. And so there was a lot of kind of grappling with, what does this mean? What kind of changes are we going to have to make? Will this really affect the work that I'm doing? Where are the boundaries of the policy? And a lot of concerns, because what we know from previous implementations is that this is a really harmful policy that caused increases in unsafe abortion, and really particularly in sub-Saharan Africa and in Latin America, and that it limited the availability of contraceptives in a lot of places. So we already knew it was bad. When it was being brought back, people just had a lot of fears and concerns around it. It was also starting to create fissures in civil society, as you had some organizations that really prioritized abortion and were very vocal about not signing from the onset, and organizations that were more focused on other issues such as HIV, with abortion being a smaller portion of their work, and therefore we're still kind of trying to figure it out, trying to weigh the costs and benefits, which is a really difficult position to be in. And now in the second year, we're really starting to see all of those fears and concerns coming to light. They're becoming a reality, and I can talk a little bit more about that later.
Okay. Jade, do you want to talk a little bit about some of the things that you saw in Kenya in the first year?
So what we saw in the first year was definitely the fear and the chilling effect of the global gag rule. What this meant was that organizations that knew that they had U.S. government funding and did not see themselves having the option to not sign on to the rule started censoring themselves way earlier than they should have, and they stopped providing services almost immediately, which definitely means that there is misinformation of when a rule like this starts to take effect, and there is also over-implementation of the rule itself, because we find that organizations that are now gagged fail to understand that there are exceptions, and when they stop providing services, they stop providing all abortion-related services, including services for post-abortion care and referral for post-abortion care and life-saving services, which are an exemption of the global gag rule. The other thing that we are now continuously seeing, especially in the second year, is the fragmentation of coalitions that did work together for a long time are starting to fall apart, because organizations that are gagged feel that they are not able to come into meetings where other organizations might probably have strategies on working on abortion, which they feel could jeopardize their funding. And for them to feel that they are being safe, they stop engaging in all coalitions that have the possibility of having this kind of programming, which is a shame, because a lot of strong work was happening because of the strength of coalitions.
What Jade said helped me remember a few specific examples of that kind of fear and overinterpretation that was happening even very early on. In South Africa, there had been a very strong kind of sexual and reproductive health movement in the 90s that was able to get the CTOP Act passed, and a lot of the kind of activists that we spoke to in the first year of the project were remembering that, and then remembering when the last version of the gag rule was in place, and how it really kind of stalled the progress that was being made in South Africa during that time. And so they were fearful that the same thing would happen, that it would really kind of sideline the conversations that are happening now around abortion access and sexual and reproductive health and rights, and really cause the focus to go back just to HIV, which we know it's really important for all of these services to be integrated. People need to have access to a full spectrum of services. So that was something that really came out there. And then also in Kenya, there were examples very early on of clinics even putting up signs outside in their window saying abortion is not offered here. So just really over applying the policy, and doing things that could really exacerbate the stigma that already exists around abortion. And there was also, just to add to what Jade was saying, a lot of confusion around whether post-abortion care was included in the policy or not, real low levels of knowledge about the exemptions or exceptions for rape and incest and to protect the life of the mother. And so we were just getting a lot of questions about, what am I supposed to do if this happens? What am I supposed to do if someone is coming to me because they were raped? Am I no longer even able to engage in a conversation because they may need an abortion?
Definitely when I looked at the first year report, it definitely seemed like misinformation or lack of understanding and not having anywhere to go, because the lack of understanding wasn't just in the organizations. It was for new parts of the U.S. government that were implementing the program that hadn't had to implement the global gag rule before. And so they didn't have anywhere to go to get answers, because the people that the programs were going to didn't have the answers either.
Yes, we saw that at all levels. So there were some of the sub-grantee organizations that were asking their primes, the organizations that directly receive the funding from the U.S. government, what does this mean? Are things going to change? And they were not able to really get straight answers a lot of times, or they were in the process of developing a proposal for a new project and asked questions like, if we get this grant, does that mean that we're going to have to sign this policy and therefore not be able to do the work that we do on abortion, and receive just no response, and therefore didn't want to go through with the process, even though they probably would have been able to get that funding. There were, a lot of questions, but also fear about asking questions.
Yeah.
Because if they were to say, need more clarification on what they can and can't do around abortion, they were scared even just asking that question would put their funding in jeopardy. So I think there was just a lack of information, a lot of confusion, but also fear about asking questions around it.
I think also to just understand that, for example, in our context, we realize that even the government, the Ministry of Health, had either little understanding about the rule itself, or were in denial about what the rule meant for services in Kenya. When we did have an interview with the Ministry of Health, their take was that because governments are exempt from this rule, that it will not affect health services. But we know that this is not true, because a lot of the services that are provided in Kenya, most of them are provided by faith-based organizations and civil society organizations, which means that when civil society organizations' ability to provide services is affected, the general health sector is affected in Kenya. So we found that either the lack of understanding of what this meant for health services, or the complete denial that this was going to affect women.
Yeah, that's a lot. And we know that with year 2, we saw even more problems. So Do you want to talk about what the new report, and we'll make sure to include links to the report so listeners can read it in the show notes and online. So you want to talk a little bit about what we've seen in year 2 now?
So what we have seen in year 2 is that this policy definitely has affected access to reproductive health services, and it is actually leading to deaths of women and girls. One of the organizations that was interviewed in the report is a sex worker organization that has worked for a long time referring women for services when they have needed safe abortion services. But because they had to sign on to the gag rule, what it has meant is that they now cannot refer women to services, and they are seeing that numbers of sex workers who are dying of unsafe abortions is on the rise. A report that has just been completed by another sex worker organization in Kenya is showing that unsafe abortion is the leading cause of deaths of sex workers. They, in their report, show that 35 women every month die out of unsafe abortions. And as we know, unsafe abortions are completely preventable, especially through use of contraception and safe abortion when safe abortions are needed. So we see that the fragmentation of services has meant that when a facility provides comprehensive services and now has to shut down clinics or has to cut down number of staff, puts a lot of burden on the few remaining staff, or makes it impossible for some women to reach a healthcare facility near them. Therefore, broadening the gap on unmet need for contraception, taking higher and higher the numbers of unwanted pregnancies. With the shutdown of safe services available for abortion, most women are being pushed to the back street, meaning that unsafe abortions are on the rise, and this is definitely leading to higher deaths of women from unsafe abortion.
Yeah, and it's just tragic that we're seeing it being the most vulnerable and the most marginalized. I mean, you were talking about seeing this among sex workers, and they're already very marginalized in the community, so it's going to affect the most marginalized the most.
Yes, the sad bit is that for women who have means or are able to pay for services, will continue to receive and access safe services. So this policy, what we are seeing is that it's continuing to marginalize those who are on the fringe of health services. This includes also young women. A good example is one of the organizations that provided free services to women and girls under the age of 18 now can no longer provide free services. They have had to even shut down some of their facilities. So there is a lot of pressure on services that were either highly subsidized or even free, and these are being shut down. What this means is that women who have been marginalized continue to be further marginalized. So we see that this is also a reproductive justice issue.
So I just want to give a little context about our project before diving into the findings.
Yes.
So IWHC's documentation project is not only in Kenya, but also in Nepal, Nigeria, and South Africa. So I started talking about those a little bit earlier. In the first year of the project, we did about almost 60 interviews, and in the second year we did 118. So the data I'm presenting is coming from more than 170 interviews that we did with civil society organizations, those working on comprehensive sexual and reproductive health, but also some that are doing HIV or other global health focused work with government agencies in these countries and multilateral organizations. We even did our best to reach out to some organizations that are kind of on the other side of things and are kind of anti-women's rights or against abortion to get a holistic perspective on what's going on. And then diving into our findings in the second year, it's exactly what you're saying. This policy is really harmful to girls, to women, and to marginalized populations. It's depriving them of essential health services and information, and it's not just about abortion. It's really affecting a whole array of services. For example, when you force a clinic to close, it is not just one type of service that's affected, especially in rural and remote areas. People might have to travel really far to access any kind of health service, and therefore, all services need to be integrated. There's really only one place that people can go, or one doctor in the region that can provide health care. And so it's the HIV services that go, it's the pregnancy services that go, antenatal care services that are no longer supported. And so that's why it creates a really difficult choice, because even if doctors or providers know that access to information and referrals about abortion services is life-saving and that women in their communities need access to that, the choice is between continuing to provide that. So the choice is between continuing to provide that very needed service or continuing to have funding to provide all of the above services. And it's really heartbreaking to have to make that choice. We did focus groups with community health workers in Kenya, where FHOK, the IPPF affiliate, had some clinics that were forced to close as a result of the policy. And they provided HIV testing and treatment, nutrition information, prenatal counseling, all types of services to their communities. But after the clinics closed, they had nowhere to refer patients that needed help. And they shared how they were still being approached by people in their community, asking them questions, like where could they go? And they had, they were really limited in what they were able to do. So it's really affecting people. It's really affecting communities, and it's always the poor and most marginalized communities, those that already have a lot of barriers to accessing services, that are affected the most.
Yeah, and I think it's important. You're talking about groups having to weigh the benefits of losing all of the services because having to close because they are not going to accept gagged funds, or making a really hard decision to stay open and provide the other services and not have to stop doing one that they believe in. So I think it's also really important to say just because groups accept gagged funds does not mean they're in support of this policy. They're having to weigh lives against lives, and nobody should have to make that decision.
This policy is so harmful because it's just based in ideology and not in evidence. So we spoke with with representatives from faith-based organizations that said, I'm against abortion. I don't believe that people should have abortion, but I also am against this policy because I know that it's going to lead to unwanted pregnancies and to people seeking abortion using unsafe methods, and it's going to kill people. So it's just not based in evidence. It's doing the opposite of what it claims to be doing, and it's really harmful and dangerous.
I just wanted to add the fact that we are also seeing, other than the facts on the services that this gag rule is contributing towards, it's also contributing towards a really toxic environment because it's leading to a heightened opposition. There's definitely an emboldened opposition right now. In the last 1.5 years, we have seen a petition to shut down Maristops services on abortion, including services that save lives, including post-abortion care. And what this has meant is that there's definitely much more stigma on an already stigmatized topic. Earlier on this year, we saw billboards with messages like abortion is murder, making women who have needed abortions or who will continue to need abortions feel more stigmatized about a service that women do need almost every day. We are also seeing a shift in funding because the funds that are from the U.S. for health are not being cut down. They are just moving from organizations that provide comprehensive services that are more progressive to organizations that are more faith-based and maybe not providing as comprehensive services as before. Organizations that also have comprehensive services have taken a long time to build capacity for them to even get to the point where they can access U.S. government funding. So to shut that down and represent it with much younger organizations that probably do not have the capacity to meet the gap that is there of the services that are there, there's definitely a gap between when those organizations will, even when they are progressive, will be able to provide services to the extent that the ones that are shutting down were. And this gap, we all know, is women's and all communities' health that is being affected. And it's really sad that that there's very little being done to document that. So we are hoping that the documentation project right now does highlight those kind of changes, and hopefully in future there is no point where we will have a policy that affects life and causes gaps in health provision because of such harmful policies that are put in place.
Yeah, I think, you're definitely seeing this report starts to outline some of the health problems we're seeing, none more serious than pregnant people dying. I mean, bottom line. And as I think, I'm going to steal from, I think Bjorn said at a panel, Bjorn at the Center for Health and Gender Equity said at a panel I was earlier, nobody on the other side is writing reports talking about the health benefits of the global gag rule because there aren't any.
I wanted to add to what Jade was saying because we're seeing that beyond these harms to health, this policy is really emboldening right-wing actors and increasing their influence on health, not only in Kenya, but also in South Africa and Nigeria in particular. We've seen examples of funding going to regressive and anti-LGBTQI, anti-sexual and reproductive health and rights groups in these places. And we know that the U.S. government is also conducting trainings and helping them build that capacity to be able to access these funds more easily. The policy is amplifying the voices of these actors while at the same time silencing advocates for comprehensive SRHR and advocates even just for evidence-based care. So it's really leaving a void where those voices can be heard even louder. And this was a concern that we heard not only from civil society organizations, but also from some of the government representatives that we spoke to. It's important for government to hear from a vibrant civil society that can really speak to the needs of their communities and their people. And this policy is making it so that they're prevented from talking about some issues that are critical.
Okay, so we're talking a lot about impacts we're seeing on the providers. Are we seeing any impacts on the governments?
I think that this is one of the most surprising findings from this documentation that we've done. The policy is really undermining government's abilities to drive its own health priorities and to set health policies for their people. This is one of the more kind of indirect and insidious results that is happening from this policy. In South Africa, the curriculum for life skills-based education is under development, and this involves different government agencies and also a group of civil society organizations that are providing their expertise on sexual and reproductive health. Because a lot of these organizations that are actually doing the writing of the policy receive their money from USAID, it's all but guaranteed that abortion will be excluded from the curriculum. And this is in a country where the Constitution guarantees a right to health and specifically includes reproductive health. Also, South Africa has one of the most progressive abortion laws, and if the result of this gag rule is that you can't even mention the national law, that's incredibly problematic and can affect a whole generation of young people that are going to receive this education.
That it would be devastating to see a country that has taken steps purposefully to make sure that there is access to safe abortion care. To see people then not be educated that it's an option would be terrible. Okay, so with all of this depressing and horribleness that we've talked about today, I think it's even more important to ask, what can people do? So what can people listening do to fight back against the global gag rule?
I think people who live in countries where the global gag rule applies need to consolidate their efforts and work together to create strategies that mitigate the harm. They need to continue to collect evidence, because before we haven't had tangible evidence of the effects of the gag rule, and use this evidence to advocate with their governments, especially for their governments to increase budgetary allocation to health services, and slowly move away from being so much donor dependent that then affects women in these kind of ways when policies are passed in other countries. So sort of get their own governmental autonomy on the aspects of health that they want to and they feel is important for their citizens. I feel that this also provides a space for activists to create awareness about safe abortion and to build a critical mass and a movement towards reproductive health rights, and build a strong movement of women that know what their rights are and are demanding for their rights and are accessing their rights under the provisions of their law, but also in ways that are accessible in their countries. I'd say for organizations that do know what the global gag rule means, create awareness about that with the media, raise voices, that also just helps build capacity for organizations that either have been gagged and need to navigate these difficult times, so that we can ensure that we are seeing less and less lives lost, even while the gag rule is being implemented, but also looking into the future, how we don't find ourselves in this space again.
From the U.S. perspective, I think there's just one solution, which is to end this policy. So there is a bipartisan legislation that's on the table called the Global Her Act. And what that would do is immediately put an end to this policy and also prevent future presidents from being able to, with the stroke of their pen, make it come back. So I think it's critical that we continue to build the evidence and build the support to educate each other and to educate our legislators that it's critically important for them to prioritize passing this legislation.
And I think that means reaching out to our friends who are already on and saying thank you, and even reaching out to those who you know won't support, but that we can't let them off the hook. We have to make sure you are telling your representatives, maybe especially if they're vehemently in favor of the global gag rule, that you're not, that it's not okay, and they need to feel the pressure from their constituents for supporting this terrible policy. All right, well, Jade, Vanessa, thank you so much for doing this. I think this was a great conversation.
Thank you so much, Jenny.
Thank you for having us.
For more information, including show notes from this episode and previous episodes, please visit our website at reprosfightback.com. You can also find us on Facebook and Twitter at reprosfightback. If you like our show, please help others find it by sharing it with your friends and subscribing, rating, and reviewing us on iTunes. Thanks for listening.